All right. Today we're going to peek behind the curtain at the official Dutch medical guideline on problematic alcohol use. We're going to break down exactly how doctors are trained to see, to identify, and then to treat what is an incredibly common but often very, very hidden health issue.
So let's just start with a number, 100 to 150. What is that? Well, in an average doctor's office with around 2,000 patients, that's the estimated number of people dealing with problematic alcohol use. That's a pretty significant chunk of any practice. But here's the real kicker.
Most of them are completely unknown to the doctor. And that right there is the heart of the issue. It's the whole reason a guideline like this is so important. It's a hidden problem, often masked by other complaints, which means doctors basically have to become detectives.
So, here's how we're going to break it all down. First, we'll look at why it's such a hidden problem. Then, what does problematic even mean in a medical sense? We'll dig into the subtle signals doctors look for, explore what the path to help actually looks like, and then wrap up with the single most important idea in all of this, acting early.
Okay, first up, the hidden problem. Let's really get into why this issue is so widespread, yet so often just invisible.
This quote from the guideline really says it all. Problems with alcohol mainly manifest through indirect signals. I mean, think about it, right? It's not like a broken bone where you can walk in and point to the problem. People very rarely walk into their doctor's office and say, "I think my drinking is a problem." Instead, the issue shows up sideways through a whole bunch of other health complaints.
So, if the signals are all indirect, how do doctors even define what problematic means? In this second section, we're going to see that the medical world has actually gotten way more precise about this and has moved on from some old kind of bloated terms.
The key term here is alcohol use disorder. Now, this is a really big deal because it officially replaces those outdated and, let's be honest, pretty stigmatizing labels like alcohol abuse or alcohol dependence. This new term frames it as a spectrum disorder. It's all about a problematic pattern that's causing significant impairment or distress in a person's life.
So how is it diagnosed? Well, this table shows some of the official criteria. We're talking about things like drinking more than you intended to, or wanting to cut down but failing, or when drinking starts to mess with your responsibilities at work or at home. But what's really surprising is that a diagnosis only requires 2 of these symptoms over a year. It's not about being a certain type of person, it's all about a specific pattern of behavior.
The guideline also makes a special point to call out binge drinking. Medically, that's defined as having a large amount of alcohol in a short time, specifically 5 or more drinks for men or 4 or more for women on a single occasion. This pattern is a major risk factor, especially for younger people, and it's tied to really acute problems like alcohol poisoning.
Okay, Section 3, recognizing the subtle signals. If the problem is so often hidden and doesn't just announce itself, what are the actual clues that doctors are trained to look for? They look for patterns. A patient who keeps coming in with these vague, unexplained complaints, like always being tired or just feeling unwell, or persistent stomach issues like acid reflux, trouble sleeping, clear signs of stress at work or home, even repeated accidents or falls can be a red flag. None of these things on its own screams alcohol, but when you put them together, they start to paint a picture that makes a doctor ask the right questions. And for young people, the signals are often completely different. It's less about those chronic physical problems and way more about behavior. A sudden drop in school performance, losing interest in hobbies, skipping school, or engaging in other risky behaviors. These kinds of changes can be a really crucial sign that something is wrong.
And the consequences of leaving this unaddressed are massive. You can sort them into 3 buckets: the physical health damage, the psychosocial impact on families, on jobs, and the societal costs. The guideline actually puts a number to this, estimating that the cost to Dutch society was about 3.7 billion euros a year from things like healthcare, lost productivity, and crime. Just a staggering figure.
So once a doctor actually identifies the problem, what happens next? Section 4 covers the path to help. And, the process is way more supportive and a lot less intimidating than many people might think. So doctors are trained to use this model, the stages of change. They know you can't just tell someone to stop. Their first job is to figure out where the patient is on this spectrum. Are they not even seeing a problem yet? Are they kind of on the fence about changing? Or are they actually ready to take action? The whole conversation and the treatment plan is then tailored to that specific stage. And the help? It often starts right there in the doctor's office. It can be as simple as having a series of supportive conversations using a technique called motivational interviewing.
It might mean a referral to an online e-health program, or it could involve medical support, like prescribing vitamin B1 to prevent neurological damage, or even medication to help someone manage withdrawal symptoms safely.
And this brings us to a really vital takeaway from the guideline. For the most part, patients can be treated right in their regular GP's practice. This is huge. It means that specialized addiction care isn't always the first step. Effective help can start in a familiar, low-key setting.
And that brings us to our final and maybe most important section. Early action is key. This is the central and I think most hopeful message of the entire guideline.
And here it is, one of the core messages. Treatment is more effective the earlier the problem is recognized. I mean, it's that simple. It's just like with heart disease or cancer, right? Catching it early dramatically improves the outcome. It stops problems from escalating and makes change feel so much more achievable. It's a shift from crisis management to proactive healthcare.
This really gets to the core paradigm shift in medicine. The old view saw this as a behavioral problem, a failure of willpower. The new, evidence-based view sees it as a complex biopsychosocial condition. That's a mouthful, I know, but it just means it's influenced by our genes, our brain chemistry, major life events, and our social environment. It is not a moral failing, it's a health issue.
Which leaves us with a final thought to chew on. This entire medical guideline is all about being more proactive. So the real question is for all of us, what if we, as a society, started approaching our relationship with alcohol with the same proactive, health-focused mindset we do for things like diet, exercise, or blood pressure? What would that look like? Thanks for watching.